Hello friends, this is Dr. Ezeugwu coming to you. Today we'll be discussing about coronavirus and what should you do about it. Currently, we don't know too much about this virus, but what we know is that it kills people. We do know, however, too, that the best treatment we have is prevention. You've heard about washing your hands, social distancing, using alcohol. All these are very important. Now, what should you do if you suspect that you have coronavirus? Well, the most important thing is to stay home, but then reach out to your doctor's office. Let them know what you think is happening. Check your temperature. Give them the symptoms you're having. In that way, they will direct you appropriately. They may direct you to go to the nearest emergency room, or to an urgent care, or to a testing center where you could be tested for coronavirus infection. If you have to go into their office, by pre-warning them about your condition, they will be in a better position to take care of you. Remember, if you did not warn them and you come in there coughing and then they get infected, then they can't take care of many other patients. So it's always better to pre-warn your doctor's office before you get there. Similarly, if you have to go to the emergency room, when you get to the parking lot, you call into the emergency room. Tell them what your symptoms are. And as always, again, check your temperature. By pre-warning the emergency room, they will be prepared and be masked and better protect themselves when you get in there, and then they can take care of you. Because again, if you infect one doctor or any of the healthcare providers, they may become vectors and begin to transmit that to other people. This is not what you want to happen. And this is what we want to avoid. So always pre-warn them before you get in there, and then they'll be more prepared to take good care of you. Now, what if you are sick and you have those fever and you have flu-like illness? What about going to church? You really don't want to go to church when you have those illnesses. You can let your church know so they can pray for you. Because remember, it is actually your faith in Christ that heals you. Not by going into church and then coughing or having people around you and touching you. This time, that's not what you want to do. Just let them know ahead of time. They can call your name, or they can just generally pray for the sick people, and you will be healed. Don't go into the church and cough on your pews, because you're going to get more people sick. Now, there are other modalities that you can also use to take care of yourself, especially if you're an elderly patient. You don't want to come out, or you don't want to be mixed up so you don't get infected. We have what we call remote patient monitoring. We also have chronic care management. These are programs designed to help take care of elderly patients from home by Medicare. These same programs are being expanded by other insurance companies to help manage patients during these times. With chronic care management, you can actually call into your doctor's office and tell them what's going on, and they can also call you on a monthly basis. You can call them as many times as you can within that month to help manage your conditions that are chronic. With remote patient monitoring, you can have a system where when you check your blood pressure, or check your blood sugar, or even check your temperature or your weight, all those information can be transmitted into your doctor's office, and they can look at it on a daily basis, and if it's abnormal, they can reach out to you and try to manage you and then direct you how best to take care of yourself. Do use these programs. They are available. You can call your doctor's office to see if they have those programs in place and set them up for you. All you need most of the time is a cell phone that can be able to do video meeting or video conferencing or video patient care, which we call telemedicine. Avail yourself to these technologies. It is for your good care. Now, what if you're in an area where somebody is coughing and they don't have a mask, and you don't have a mask? Well, first of all, you can cover yourself with your clothes and move away from that individual. Again, the more distance you have from that individual, the less the chance of you getting that infection. We have to be wise at this time to really use preventive measures to help us curb the spread of coronavirus. It is the right thing to do. So please do that. Thank you. This is Dr. Ezeugwu.